What's up, Sci Fam? It's your boy, Nickel. What up? All these abbreviations and such, I just couldn't help myself. Today, we're going to learn about COVID-19 IRL. Yep, if you didn't know, IRL stands for in real life. So let's look at COVID-19 in real life. What's been happening? Well, we're going to start by understanding just how it's passed on from one person to another. And we call that modes of transmission. So we already saw how the transmission rate relates to other types of diseases, but let's look at actually how people are transmitting it from one person to another. So different modes of transmission are things like micro droplets. So if you remember, I said that aerosols, this virus can live in aerosols in microdroplets, basically suspended in the air for up to 3 hours. And those microdroplets are going to enter the air from people coughing, sneezing, and just the normal breathing even. So that's why you see so many people wearing masks and why they're suggesting masks. And those masks have to cover your whole nose and mouth so that no microdroplets could enter from the sides or anything. And so one way that you could contract the virus and the disease is from microdroplets, those little things in the air, aerosols, or just from directly touching an infected person. Makes sense. If they're infected, if you touch them, that virus is likely living on their body. If they cough into their hand then has that virus on it. People can also get it from airborne particles. So I guess microdroplets and airborne particles can be similar. The airborne particles are more like what we would consider the aerosols, even though I said the microdroplets were like aerosols. Microdroplets can rest on a surface too. So think about if someone sneezes, that those water droplets in the sneeze are going to fall faster. They're not going to be aerosols. They're not going to stay in the air necessarily. They're going to fall onto surfaces. So those microdroplets could land on surfaces and infect the surface and cause somebody to get the COVID-19 disease from the virus. But when someone sneezes, some of those particles will be airborne particles, and we call those aerosols. So those can live in the air for up to 3 hours. The microdroplets, so it depends where it lands, and that will determine how long it would, the virus would be able to stay alive. And then also the last one is that actually they're starting to see that fecal matter can also transmit the virus. And if you remember, this virus, SARS-CoV-2, it attaches to ACE2 receptors, and there's ACE2 receptors in people's colons, so it makes sense that fecal transmission would be possible. Okay, well, if somebody does transmit or get this disease through some type of transmission that we just listed, it can be a lethal disease, and that's why people are really asking everyone to follow the precautions here, because it can be lethal, but it's basically lethal for just certain subpopulations. So what I mean by that is it's just certain groups in our overall population are more likely to have lethal effects from this drug. So who are those subpopulations? Well, it's basically anyone that's over 70 years old. It's also people with underlying health conditions. Now, this can be all types of different things, from hypertension to diabetes, and even people with immune system issues. So people with underlying health conditions, their body's already kind of compromised, so this could become lethal for them as well. Also, it can be lethal for people that take a certain type of drug that is called an immunosuppressant. So that a suppressant kind of reduces something, and if it reduces your immunoresponse, your immune system, if it's telling your immune system not to work so hard, well, we need our immune system to fight off this disease. And if people are taking medicines that are telling their immune system to chill out a little bit, well, when this disease comes in, their immune system's just chilled out and it doesn't attack it. So therefore, it can really cause bad reactions in people taking immunosuppressants. So let's write this down. What are immunosuppressants? They're drugs that are going to reduce the immune system response in the body. Okay, there's one other group of people who this could be lethal for, And it is healthcare workers and first responders. These are people like firefighters, ambulance drivers, people that respond. If you call for an emergency, the people that show up, police officers, those are first responders. And actually, this one right now is a question. They're not quite sure why these people are contracting worse COVID-19 symptoms and actually dying at a higher likelihood than other populations. So this one's still unknown, but some of the ideas are that healthcare workers are exposed to it more often, so they gain more and more of it, so it has a bigger effect on them. And same thing with first responders. And they're also typically going to be interacting with some of the worst cases, the virus that's most aggressive. So when it gets into their system, it could be a really aggressive case. But these are just ideas. They're still not sure about that because, again, this is all just developing as I'm recording right now on March 19th, 2020. Okay, well, some subpopulations it can be lethal for, but then it's one of the biggest challenges with this virus and disease is that other subpopulations or groups within our population, other subpopulations are actually less affected. So they're not dying, actually. And they don't have very severe symptoms either. And these subpopulations that are less affected are actually children and adolescents, or teens, basically. Children and teens or young adults are not being affected very bad. They're not showing very bad symptoms. And so this is a really important fact, actually. If you're a child or an adolescent or a teen, it's not one of those times to be like, woohoo, yay, because you're actually a really important piece of the puzzle. So let's look at, and I'll explain that as we kind of unwrap how this COVID-19 is negatively impacting our communities. Because, as we talk about a virus and how it causes a disease. Well, it's easy to transmit it because it lives for a long time on different surfaces. And because of that, our communities are having to create a community response. Like, we're all having to band together for this. So as we're doing that, we need to understand why these dramatic precautions are being taken. And so if we look at why this is all kind of transpiring as it is, or at least some of the ideas, is that when, so look, the way it's negatively impacting like these whole communities is when our healthcare workers and our first responders, so like our doctors and our police officers and ambulance drivers and firefighters, when they get sick, well, oh man, we end up we lose people with the skills to care for the sick. So think about this. If a doctor is trying to help people that are getting sick and that doctor gets sick, that doctor's been in school for a really long time and has a special set of skills. We can't just replace that doctor with any other old person. The same thing is true with the professionalism of a police officer or an ambulance driver or a paramedic that's in the ambulance or any of those first responders. They have really valuable skills. And so if one of those people get sick, they have to quarantine themselves. They might even die from the disease. And we lose those people. And unfortunately, it's really hard to fill those positions. And if we don't have as many healthcare workers and first responders, then we end up losing the ability to help more and more people as they get sick. So you can see it's kind of a slippery slope, you could say. So another negative impact to our communities is that the infected people that become sick, the infected people that become, like, we'll say really sick, puts more stress on hospitals, because when people become really sick, what happens is that they end up, their lung cells start to die because those cells are being overwhelmed. They can't do their job anymore, so they have to be put on ventilators. Well, in order for all that to happen, then people have to get admitted to this thing that we call the intensive care unit, because they have to have special equipment with special doctors and special precautions, so they have to be admitted to the ICU. Well, the ICU only has a certain number of beds. And so as those beds start to fill up and more people become sick, well, hospitals have to scramble to figure out where are we going to put that extra person that comes in sick, because all the hospital beds are filled up already. So as more people become really sick, it puts more and more stress on the hospitals. And if we're losing doctors, again, that puts more and more stress on everything. So, as I said, I would talk about healthy people, children, and adolescents. Why is that actually something that is negative? Well, healthy people, children, and adolescents, or remember, that's the same thing as like teens or young adults, they may not show symptoms. But you may, or if you're a teen or a child, well, you may be what we call a carrier, meaning that you actually have COVID-19, the disease, and you're not showing symptoms, but you have it. And we know that it can be transmitted really easily between people. And so it actually increases the transmission rate of the transmission rate of the disease, because if people are walking around like, oh, I don't have it, but they do have it, and they walk into a store and they cough on their hand and then they wipe their hand all over all the Kleenex boxes, well, everyone that buys those Kleenex are going to become infected. And if one of those people is over 70, or if they have an underlying health condition, or if they're taking immunosuppressants, or they have any type of, compromised health, then they can become lethally infected by this disease. And so it's actually kind of freaky that some people that have the disease aren't showing symptoms because they're just living their normal lives and they're thinking that they can just go around. And that's why we're asking everyone to stay away from each other, because even if you don't think you're affected, we want to make sure that you're not going to pass it on to anyone else. This is what's happening, folks. I.R.L, COVID-19, I.R.L. Here we are. It's March 19th. I'm sure things will change as you interact with this material, but keep an eye on the news, and I.R.L will progress as we learn more and more, and as we all take the necessary steps to try to prevent this from spreading too far. I'll see you on the next one, folks. All right. Nickel out.